Hello everybody. Today we are going to discuss about certain problems regarding ENT, and among them today is the subject has been undertaken, that is problem of the ear. When dealing with the patient reporting the ear trouble as a prominent symptom or presenting symptom, these symptoms often stand so striking that most of the established physician as well as the newcomer tries to base his prescription on that similar symptom. In several instances, it is beneficial, but at the same time, certainly it develops a trend of shortcut approach in the vast process of the case taking, discarding its on the whole scope. There is no question of denial for the importance of rare, peculiar, or striking symptoms in the selection of the remedy, though the process of treatment requires a thorough knowledge about the patient, about knowledge about his all aspects, which is tried to trace in the proper case-taking procedure for the purpose to select the remedy, to plan the aftercare measures and estimate the prognosis. To fulfill these requirements, we have to go through proper line of treatment without overlooking any step in the series of the proper case taking, and it should be planned considering firstly the general interrogation, including presenting symptoms, mental symptoms, constitutional setup, family history, back history, tracing any probable or apparent etiological factor, etc. And afterward, collection of objective symptoms by observation through naked eye and with the help of appropriate diagnostic devices. As a matter of fact, observation of any organ or part of the body reveals information in two folds. Most of them are concerned to the part involved, but some findings also display about something happening wrong at the remote. Accordingly, observations of ear also do the same, and few among them are relevant to be quoted here. Study of the structure of the auricle is almost first to start the observation, and one may find any malformation like prominent auricle, commonly known as bat's ear, like this one. I would like to draw your attention towards one of the movie named P.K., under which the character was given the same appearance. And if you have not gone through that movie, you can confirm yourself here. This type of appearance is known as bat's ear. It is almost its dimension and structure represents the auricle of in the bat. And the next one, like this here this one, you may observe these are the cartilaginous overgrowth. These are the small accessory cartilaginous auricle, discarding the normal anatomical figuration of the ear. Likewise, appearances are representative of psychotic manifestation. And on the basis of this type of appearance, we can trace the person under the psychotic trend and can proceed further for the purpose to treat him accordingly. Except this, on the other hand, any structural abnormality associated with other remote deformity like asymmetry of the face, this one is here the spina bifida. This one spina bifida. Here you may observe this bulging from the spinal cord. The outer covering of the spinal cord is bulged here, or here you may observe the cleft palate. This one, this is the cleft palate which has been reconstructed after surgical interference here. Now these type of deformities represents the syphilitic trends. Again, we shall consider the change in color of the ear. That is like the auricle grows pale from fright, chill, spasm, loss of vital fluid, exhaustion and frost. A marked paleness of the left auricle denotes inflammation of the spleen. It should be noted very clearly that all those things which I have described here, these are the result of fright, chill, spasm, or loss of vital fluid, or exhaustion and frost. But especially it should be kept into view that if only left auricle appears pale, it denotes inflammation of the spleen. Now you can see here, just by observing the ear, you can think about the inflammatory condition of the spleen. And the next is the redness of the auricle is found in congestive and inflammatory condition of the head and ear. Here this one, congested and red auricle appears in the cases of inflammatory condition of either in the region of head or ear itself. Next, flushes are caused by mental emotion or occurs before bleeding from the nose, delirium, apoplexy, the flushes of auricle. Next, a habitual or frequently occurring redness of the auricle denotes disturbed action in the abdominal organ or else menstrual or hemorrhoidal affection. Again, a striking redness of the auricle in newborn infant is a sign of premature birth. Further, small inflammatory purplish suppurative spots on the auricle are a sign of the chronic syphilis, like this. This one, here you can observe this type of appearance is a typical appearance in the secondary syphilis. And with regret, I would like to draw your attention towards one thing which I failed to show you. This is that I quoted the asymmetry of the face. You can compare it here. This person, asymmetry in the face of this person. Now we shall consider the thermal changes in the auricle. The auricle turns hot in inflammatory and congestive condition. Next, the cold auricle. The cold auricle felt in chill, spasm, and from exhaustion. Habitually, cold auricle are found in the weak and chlorotic persons. In hysteric persons, cold auricles are the forerunner of a hysterical spasm, while in delirium and mania, they denote a cessation of the paroxysm. Again, now we shall talk about a few observations in regarding movement of the ear. If the movement of the auricle increases the pain or discomfort in the tender ear, it simply indicates that the lesion is remaining within the external acoustic canal. It may be boils, it may be dermatitis, or it may be a result of injury. But if the seat of tenderness lies in the middle ear, the external cartilaginous ear may be moved freely without adding to any patient's discomfort. Again, having remains unaltered in lesion of the external ear, provided the swelling caused by them is not to such an extent that can occlude the total air space of the lumen, but hearing is always altered in middle ear infection. Here again, one thing very clearly you can discriminate. Suppose there is a case of mastoid abscess. Frequently it mimics the pain of the ear. You can very easily discriminate either it is a pain due to mastoiditis or it is a lesion in the ear. you simply lift up this auricle upward. This one. If the pain aggravates, it means the lesion is remaining in the ear. And if pain remains unaltered, it means it is the lesion of the mastoid process. Now, just I told that movement of the auricle is not affecting the pain level in the middle ear, certainly, but here it should be discriminated by simple touching, that if you touch upon the mastoid, it appears tender, and afterward if draw the pinna upward, and pain is not concerned with that, pain is not altered by this movement, it clearly indicates that it is the concern with the ear and not with the mastoid abscess or any mastoid inflammation. Next, we shall consider the discharge. It has been excessively dealt in the homeopathic literature and most frequently stands as central pillar in the selection. Different characters of discharge from the ear gives valuable diagnostic and prognostic hint, as thick pus may come from the recent ruptured boils. If any boils, that is called furuncle, bile occurring in the Eustachian canal, and ruptures, just it will escape a mucopurulent pus. And next, if the blood alone may be coming from any recent tear in the skin of the ear passage, but if blood or cerebrospinal fluid escaping from a tear in the tympanic membrane following a fractured base of the skull, it means in case of accident or injury, it shows the blood is coming from the internal region, and it is a very grievous indication. The patient should be admitted into the ICU, or they should be sent to the operation theatre as early as possible for the purpose to correct these lesions. Now, when the observation is done with the help of horoscope, the observers may find, that is, the normal tympanic membrane appearing oval in shape, placed obliquely, closing the external passage. Now you can observe here. Here you can observe the external ear is obstructed or occluded by this one. This is the tympanic membrane, and this tympanic membrane, I told you, here it appears like this. It is an oval structure which is set here obliquely to close the external or divide the external ear from the middle ear. Now, the normal tympanic membrane appearing oval in the shape, placed obliquely, closing the external passage. Its upper 1/3 appears like pink, and the lower 2/3, this one here, this upper 1/3 portion, which is also known as annulus, it is because the thicker than the lower portion. This upper 1/3 portion is pink, and lower two-third having a faintly bluish tinge of the color, and near the center where the shaft of malleus here, this area is known as umbo. Here the shaft of malleus is adjusted with the tympanic membrane. Acha. Where this site appears pale creamy in color. Now, any unusual redness or bulging of the tympanic membrane should be noted. Bulging or convexity of the tympanic membrane indicates fluid, pus, or increased air pressure in the middle ear, while restriction of concavity often indicates obstruction of the eustachian tube. Here you may see this is the tube which connects the middle ear with the pharynx, and if any obstruction occurs in the course of this tube, you may feel the bulging in this tympanic membrane. It bulges this side. Again, the malleus may appear severely retracted if the ossicles have become partly fixed from the old arthritic changes. This one is the malleus. This one is the malleus, and it is attached here with the tympanic membrane, and under effect of any such type of arthritic changes, if its movement is restricted, then it appears severely retracted. Again, if the auditory tube remains closed for a long period, again this tube, if this tube remains closed for a long period, serous fluid may collect in the middle ear, and it may be seen through tympanic membrane as a fluid level and may move and form bubbles. Here it is important to know that in the newborn healthy infant, serous fluid normally fills the middle ear. And this fluid only disappears after air has entered the infant's middle ear cavity up to the eustachian tube. It means when the newborn baby started respiration. In perforation of the tympanic membrane, recent tear is evident by fresh or dried blood, mostly after a head injury. Thus, auroscopy should essentially be done in all cases of head injury. Further, in otosclerosis, the tympanic membrane found intact with limited conduction of the sound and fixation of the ossicle. There is a chance of formation of osteoma at this level, and osteoma are fairly and frequently seen close to the tympanic membrane like this. This one here, this is the osteoma, and this one is the tympanic membrane. In the neighboring hood of the tympanic membrane, here it is the head of the malleus is seen, and above this the osteoma is visualized. A other portion of osteoma is also looking here. Here I want to say that the osteomas are fairly and frequently seen close to the tympanic membrane, and they appear as rounded swelling causing deafness. These are common in swimmers. Now, a few observations also be confirmed with the help of X-ray and can give the evidence that number one, bone disease such as erosion or sclerosis or fracture or widening of the internal auditory meatus, which may help in diagnosis of the acoustic nerve neuroma or posterior fossa tumor. These are just example to draw your attention towards widespread investigative views which are recorded and it is required to be exercised when dealing with ear trouble. Except these tests for hearing, vestibular function, consideration of the vertigo, etc. are some other important aspects which are required to be done. Estimating in this way, when maximum possible informations are obtained, it becomes easy to prepare an adequate prescription. Well, prior to submit, it would be necessary to clarify why I have so strongly opposed the selection on the basis of seemingly important but single symptom, and if it is given importance, then to what level. Actually, likewise, symptoms are of importance only to draw attention, and if other symptoms correspond, can stand as a remedy. In this sequence, I would like to quote a few instances as follows. Any ear trouble with a sensation of dilatation in the meatus in which cold air is blowing and felt up to the tympanic membrane, it boldly points toward the mesothelium. But the sensation of blowing air, as you know, under homeopathy, everywhere each and every symptom is subjected to be discriminated on the very subtle instances, and a fine discrimination is always necessary. In this regard, here I would like to compare that this cold sensation in the ear is also found of equal importance under causticum and staphysagria. Now, it may be confusing, but you have to discriminate, you have to differentiate among them that causticum and staphysagria note shows the sensation of dilatation of the meatus. On this basis, these may be separated, and again, the mesothelium should be confirmed on the basis that in most of the cases, or you may say usually, there is a history of eruption in the skull which boldly points towards the mesothelium. It means by considering these features, you can confirm mesothelium to maximum extent, but it further requires some other correlations. Again, any ear trouble. A few other hints would also be relevant as in opposed to the prior sensation, there may be a sensation of hot water. Sensation of hot water running out of the ear, especially from the right. It indicates chamomilla very prominently. While of cold water coming out from the ear, it represents the Merksol. Again, sensation of water in the ear points towards sulfur, while sensation of something rolling to and fro in the ear, on shaking the head, it draws attention towards Ruta. We can also consider some standing features like excoriating discharge from the ear after suppression of skin eruption, most frequently met with the sulfur. Again, the calcareous deposit on the tympanic membrane draws your attention towards the calcarea floor. Here, as I described earlier, that when horoscope is used to visualize the tympanic membrane, you will find a powdery deposit on the membrane from the outside, and it points towards the indication of calcarea floor. Now, again, you will find there are a few most frequent occurring features, usually in young girls. They frequently feel the suppression of ear hole due to some nickel or likewise ring. This is that if I don't wear the golden ring, I frequently feel within a few hours that my ear becomes sensitive. This particular feature is most prominently met with the lachesis. But apart from the lachesis, sternum and meduorinum are also of equal value following comparison of certain their own features. Again, a few medicines may be traced on the basis of involvement of the particular region or particular site of the ear, like eruption on the antitragus represents spongia, or eruption on the tragus pulsatilla. Again, vesicular eruption on the concha, it points towards phosphorus, but it must be noted that if such vesicle occurs as a result of contact of certain irritating ear discharge, it indicates tellurium. Again, if itching is felt on the lobules, it is muriatic acid, and if at the tragus, it requires argentum metallicum. Copper colored notes on the ear, it is not frequent. It frequently occurs in a very rare occasion, but if occurs, it should be met with argentum metallicum, Merksol, or graphitis. And other few features relating of modalities are also noteworthy, as stopped sensation comes on blowing the nose shows sulfur, while if it is relieved, it indicates the murk salt. Again, stopped air open with loud report or yawning or swallowing draws one's attention towards silesia, while deafness caused by loud report comes under CPR. Now, regarding tumor, acid nitric and calcarea carb are almost the prominent names frequent to call for. And likewise, it is not usual to include all the features. For the rest of feature, you may be referred towards the repertory and materia medica. I only want to draw your attention in particular way that if guiding by these prominent and presenting symptoms, you can think about certain particular features and considering the procedures which I have described under the case taking, these should be taken into account, and considering these all, you can reach to the simillimum, and I think this would be sufficient what I want to say you. Now, I would like to put an end to my speech on this episode, and again we meet with other problem. Thank you.